Maybe Dr. Shakti Vadivel can take up the next.
Good evening to all. Thank you for calling me as the chairperson for post-processing, sir. Even though this is my parent institute, so I am very much happy to be a chairperson in my parent institute. Medicon, thank you for calling once again. So I call upon Dr. Nandini to present a presentation on ageusia.
Good afternoon. I'm Dr. Nandini, ENT postgraduate. My poster is about the incidence and characteristics of ageusia in COVID-19 patients. Introduction: COVID outbreak caused by SARS-CoV-2 began in the month of November 2019 in Wuhan, a city from China. COVID-19 infects in different ways based on each individual's immune response to the virus as well as the viral strains. Initially, anosmia and ageusia were not considered to be the symptoms of SARS-CoV-2, but during the month of April and May, many subjects infected with SARS-CoV-2 experienced severe olfactory dysfunction as well as gustatory dysfunction. Methodology: this was a prospective observational study which included 6 hospitalized COVID-19 patients who met the inclusion criteria between the month of May to June 2020 in a tertiary care center, Tandalam, after obtaining clearance from ethical committee. It included patients with history of loss of taste sensation. They underwent the test for taste sensation. All 4 taste sensation was tested using the guidelines given by Human Neurophysiology Laboratory Manual of the Department of Electrical and Computer Engineering, University of Cyprus, and the concentration of the taste solutions prepared was given below, and water was used as a control. And the testing procedure was explained to all the patients, which included that the patient has to rinse their mouth twice with water, and then each taste tint was provided to them, which has to be held in the oral cavity for 5 seconds. And after testing for the taste sensation, an online questionnaire was provided to them, and were asked to grade the taste sensation from 0 to 12, where 0 means no sensation and 12 means the maximum or the utmost sensation. And the same procedure was repeated on day 1, 3, 5, and 7. My results were, and among the study participants, 18.6%, that is 85 out of 456 of them had ageusia, and the most commonly affected age group was being 20 to 39 years, which was 61%, and there was slightly a male predominance in the sex distribution. And the symptoms associated with ageusia were fever, body pain, diarrhea, and other sinonasal symptoms like headache and postnasal drip. And the taste sensation which disappeared first was the sweet, and the taste sensation which was reappeared was the salt sensation. The average duration of loss of taste sensation was around 6 days, and 96.5% of the study participants had recovery rate by day 8, and 3.5% of the patients had a persistent loss of taste beyond 8 days. This is the demographic detail of the study participants, and this is a table for taste sensation. 64% of them had lost the sweet sensation first, and 70% had salt sensation which regained first. And this is the other associated symptoms with ageusia. Discussion: the study reports an incidence of 18.6%, which is much higher than the study conducted by Mao et al., which reports an incidence of 5.6%, and study conducted by Pranav et al., which was 4.1%. And according to this study, ageusia and anosmia appear before the other symptoms in around 40% of the COVID patients. And in general, the anosmia and the ageusia occurs in the early stage of the disease. This is supported in the study conducted by Vaira et al. And Yongkyun Lee et al. And this is in contrast to the study conducted by Nakagawara et al., which shows that the onset of olfactory and taste dysfunctions occur in the late phase of the COVID disease. And the average duration of gustatory dysfunction was 9 days, as per the study conducted by Vaira et al., which is fairly in accordance to this study. And in conclusion, anosmia and ageusia are 2 important symptoms of COVID-19, which usually appears in the early stage of the disease. So it's preferable to pick up these patients on an earlier basis and test for COVID-19 to break the chain of transmission. And these are my references. Thank you.
Good presentation, Dr. Nandini.
Yes, sir.
I have few queries.
Yes, sir.
So in your discussion part, in conclusion, you mentioned that there is combination of ageusia and anosmia.
Yes, sir.
Did you test for anosmia in these patients?
So I did not check for anosmia, so I just checked for ageusia alone.
Then how did you conclude that both ageusia and anosmia is?
In the questionnaire, we asked whether they had anosmia also, but we did not get into the detail on which day on the recovery rate and also. Whether it was associated with anosmia or not alone, we just asked that, sir.
And how did you test that? Which sensation you tested first? You said sweet is tested first, or now which sensitive tested first or last?
In the order of sweet, salt, sour, and bitter, sir.
Why the bitter is tested last?
Because it might alter with the other taste sensations, so we check it at the last.
And regarding your any exclusion criteria you took for your study?
Sir, age group, sir, above 65 years, we have included, excluded them.
Any other exclusion criteria? Because any other condition that can produce dysphagia or agesia like smoking, alcohol, have you excluded all these patients?
So no,
Smokers,
sir.
alcoholics, and even diabetes, hypothyroidism, any pregnant patient,
So pregnant, we do not include pregnant ladies, sir.
any local pathology like dental caries, gingival diseases, have you ruled out all those things?
So we did not rule out, we did not exclude smokers and alcoholics, sir, but we have excluded the oral ulcers, like after ulcer and dental caries, we have excluded, sir.
And, can you tell me the mechanism of agesia in COVID? Just out of academic interest. How does it produce agesia?
So probably might damaging the papillae.
Okay, the virus damages the pores of the cells, and there's inflammatory cells also damage the papillae.
Yes,
So
sir.
we can do. Good one. Thank you.
Thank you, sir.